When we are learning about the variety of thermal receptors, the variation of thermal receptors, the sensitivity level of thermal receptors of different areas of our body, their distribution in our body, we should be knowing about their adaptation as well. So the stimulatory effects of rising and falling temperature. Now when a cold receptor is suddenly subjected to an abrupt fall in temperature, it becomes strongly stimulated at first, but this stimulation fades out rapidly during the first few seconds and progressively more slowly during the next 30 minutes or so. Which means that when the temperature of the skin is actively falling, a person feels much colder than when the temperature remains cold at the same level and vice versa. Now, what is actually the mechanism of stimulation of thermal receptors? The cold and warmth receptors, they are being stimulated by changes in their metabolic rates, and these changes result from the fact that temperature alters the rate of intracellular chemical reactions more than twofold for each 10 degrees centigrade change. So what is very important for us to remember is that for like 10 degrees centigrade, there is the rays of intracellular chemical reactions for twofold. So you can say that if there is a rays of 10 degrees centigrade, there is 2 times increase in the basal metabolic rate. There is the concept of spatial summation of thermal sensations. The number of cold or warm endings in any one surface area of body is slight. It is difficult to judge the gradations of temperature when small skin areas are stimulated. When a large skin area is stimulated all at once, the thermal signals from the entire are summate. Now, how the transmission of thermal signals in the nervous system. We all know that there is actually the order of there is three order neuron system. So the first order for all the sensations, over here the same rule applies, that is over there in the spinal cord. Then we have the second order neuron for the pain and temperature and simple touch. The second order neuron arises over there in the spinal cord, and they actually decussate, or you can say that they cross over to opposite side at the spinal level. And for all sensations, what happened that the third order neuron actually arises over there at the level of thalamus, and then they pass to the sensory area of cerebral cortex. So all of you are actually advised to keep this three order neuron system in your minds, and remember that on entering the spinal cord, the signals they travel for a few segments upward or downward in the tract of Leishore, and then they terminate mainly in the lamina 1, 2 and 3 of dorsal horns, the same as for pain. After a small amount of processing by one or more core neurons, the signal enter long ascending thermal fibers which cross to opposite anterolateral sensory tract and terminate in both. Where they are going to terminate? In the reticular areas of brainstem in the ventrobasal complex of the thalamus. So you can say that the first order neuron is over there in the level of spinal cord. The second order neuron they are in the spinal cord and they cross to opposite side at spinal level, and the third order neuron actually goes from the brainstem thalamus to that of the sensory area of cerebral cortex. Few thermal signals are also relayed to cerebral somatic sensory cortex from the ventrobasal complex. So cortical somatic sensory area 1 has been found to be directly responsive to either cold or warm stimuli on a specific area of the skin. Removal of entire cortical postcentral gyrus in the human being reduces but does not abolish the ability to distinguish the gradations of temperature. So it is very important that the cortical somatic sensory area is not the only area which is responsible for perception of cold or warmth, because in experiments it has been seen that human beings, if they are actually being removed by this cortical postcentral gyrus, this although this ability decreases, but the ability to distinguish the gradations of temperature is not totally removed. Now let's see. You're all supposed to draw and label this diagram in your logbook. Look at this diagram. You can see that there is the first order neuron, which is what? Over here, it is actually the nerve fibers which are carrying the sensations of pain or cold or warmth, and you can see that they are going to relay over there in the spinal cord. Then the second order neuron arises from the spinal cord and is going to decussate, that is going to cross over to opposite side, and they are going to ascend in the form of anterolateral tracts, which are the anterolateral spinothalamic tracts. They are going to ascend and they're going to relay over there in the thalamus again, and they're going to relay in the thalamus as well as in the reticular substance of the brainstem. They're going to relay, and then from there the third order neurons, they arise and they are going to go to that of the postcentral gyrus, which is the somatic sensory area 1, and that is going to give us the perception of different ranges of pain and temperature. Now you can see how these fibers, the A delta fibers, the C fibers, how they're going to give their these are going to relay over there in different laminas of the spinal cord, and from there the second order neuron arises and they are going to go to the opposite side, the crossing over occurs, and then they are going to ascend. Now again, this diagram is quite important. You all are supposed to make it on your logbooks, and now when we are learning about different thermal receptors, their sensitization, their properties, we are learning about adaptation, we are learning about their pathways, we should be learning about their pathophysiology. So regarding this, the two things which are very important, they are the first one, that is the syringomyelia, and the other one is the syringobulbia. The first one, that is syringomyelia, which is actually characterized by a progressive cavitation of the central spinal canal, most commonly occurring in the cervical spinal cord. It is actually a disease which is resulting from the excessive growth of the neuroglia. What is neuroglia? Neuroglia are actually the protective cells over there in the brain, and there is excessive growth of these neuroglia accompanied by the cavity formation in the gray matter. And what happens is that there is the dilatation of the central canal of spinal cord. This dilatation presses and damages the tracts which are crossing near central canal, which are like dorsal and ventral spinothalamic tracts. So what is actually the result in this? That there is the loss of pain and temperature on both sides due to damage to dorsal spinothalamic tracts. There is decrease in simple touch on both sides due to damage to ventral spinothalamic tracts. And so as a result, there is bilateral loss of pain and temperature. There is a cape-like distribution. There is loss of pain, temperature on both shoulders, upper extremities, just as a person wears a cape. As the cavitation progresses, the motor neurons that reside in the ventral horn of the spinal cord, they become compressed, resulting in bilateral flaccid paralysis of upper extremities as well. So what is important over here is that fine touch is not lost. Why? Because it is actually being carried by the fasciculi, gracilis and cuneatus, which are not damaged, since they travel in dorsal column and not in the central canal. So it is quite important. There is another term which is quite important, and that is the dissociated sensory loss. If there is loss of pain and temperature without the loss of touch, as in syringomyelia, it is called dissociated sensory loss. Then we have syringobulbia. Syringobulbia is actually the upward extensive, or you can say upward extensive extension of cavity formation to involve the lower brainstem, and over here we have the same effects, like there is sensory loss on face, there is Horner syndrome, there is nystagmus, there is flaccid paralysis if it is extensive. So it is quite important. You can see there is a formation of cyst filled with that of the cerebrospinal fluid. Syringomyelia is a generic term referring to a disorder in which a cyst or cavity forms within the spinal cord. This cyst is known as syrinx, can expand and elongate over time upwards to brainstem, known as syringobulbia. The damage may result in pain, paralysis, weakness, stiffness, and it can cause loss of ability to feel extremes of hot or cold, especially in the hands. And it has the cape-like loss of pain and temperature. So that's all for today. And thank you very much. Stay blessed. Allah Hafiz.